Okay, I need to tell you something, and I need you to stay with me here because this is important. A healthcare business owner in Minnesota just got charged with stealing over $3 million, not from a bank, not from investors, not from some faceless corporation, from Medicaid. From the program designed to help the most vulnerable people in America, the elderly, the disabled, children living in poverty, and she did it for years, right under everyone's nose. Stay with me. What I'm about to walk you through tonight is something that's happening all across this country, and most people have no idea how big it is. And I mean that literally. I've looked at the numbers. I've gone through the federal data. Medicaid fraud costs American taxpayers somewhere between $80 billion and $100 billion every single year. Let that sink in. And here's the thing. This isn't just about money. This isn't just about one bad actor gaming the system. This isn't the usual story, where someone files a few false claims and gets a slap on the wrist. This is different. This is about a fundamental breakdown in how we protect public resources. This is about what happens when oversight fails, when systems get too big to monitor, when we assume that people providing care actually have the best interests of patients at heart. That assumption just cost Minnesota taxpayers over $3 million. And what I'm about to show you suggests it's costing all of us far, far more. Picture this. It's a typical day at a personal care assistance company in Minnesota. Staff members are clocking in hours. Paperwork is being filed. Medicaid claims are being submitted electronically, efficiently, routinely. From the outside, it looks like any other healthcare operation, nurses coming and going, timesheets stacking up, the quiet hum of a business serving vulnerable people. But inside those files, something else is happening. Hours that were never worked, services that were never provided, money flowing from public coffers into private accounts for years, over $3 million worth, and nobody caught it. Not for years. Not until federal investigators finally pulled the thread that unraveled everything. Now, I've been following these cases long enough to know the difference between small-time mistakes and systematic fraud. I've watched company after company get caught, pay fines, and walk away. I've watched the federal government announce crackdowns that somehow never seem to crack down on anything. This is not a mistake. What happened in Minnesota is a case study in how healthcare fraud actually works. The owner and I am going to walk you through exactly what she is accused of allegedly created a system for stealing. Not a single incident, not a moment of weakness, a system. A years-long operation designed to extract public money through falsified records, fabricated services, and the complicity of people who were supposed to be working for her. Here's what the charges allege. The owner of this personal care assistance company systematically submitted claims to Minnesota Medicaid for services that were never actually provided. We are talking about personal care services, the kind of help that is supposed to go to people who can't bathe themselves, who can't dress themselves, who can't manage daily tasks without assistance, people who depend on this program to survive. Think about what that means. Think about it while someone was filling out paperwork, claiming they provided care. Real people who actually needed that care may have gone without, while someone was calculating how to maximize their fraudulent claims. Vulnerable Minnesotans were trusting that the system was working for them. The alleged scheme worked like this. Employees would submit timesheets for hours they never worked, or the company would bill for services to patients who didn't receive them, or worse, and this is what makes these cases so insidious, they would bill for phantom care to people who genuinely needed help but never got it. The paperwork looked legitimate, the claims processed normally, the money arrived month after month, and no one asked questions for years, over $3 million. And here's why this matters beyond Minnesota. Here's why this one case tells you everything you need to know about a national crisis. This wasn't sophisticated. The alleged scheme was some brilliant criminal mastermind outsmarting the system with clever loopholes and offshore accounts and layers of shell companies. It was, according to the charges, straightforward fraud, fake claims, false documentation, basic theft dressed up in healthcare paperwork. And it went on for years. That tells you something not about the criminal, about the system, about oversight, about how easy it apparently is to steal millions of dollars from programs meant to help the most vulnerable Americans. To understand why this keeps happening, you have to understand how healthcare fraud operators actually think, not the caricature, not the movie villain, the actual operating logic. They don't see Medicaid as a sacred trust for vulnerable people. They don't see claims processing as a system they're morally obligated to respect. They don't see themselves as stealing from elderly people and disabled children. They see an opportunity. They see a system that processes claims automatically. They see money flowing through channels with minimal verification. They see what looks like a victimless crime. It's just the government, just paperwork, just numbers on a screen. That rationalization works in the fraudster's mind. You can convince yourself it's not really hurting anyone. You can tell yourself the government wastes money anyway. You can separate the paperwork from the people it's supposed to serve. But healthcare fraud isn't victimless. Every false claim is money that didn't go to real care. Every fabricated hour is an hour someone might have actually needed. Every dollar stolen is a dollar that made the entire program weaker, more vulnerable to cuts, more likely to fail the next person who genuinely needs help. That rationalization. That ability to disconnect the crime from its consequences is how 3 million gets stolen over years, bit by bit, claim by claim. Each individual submission small enough to avoid triggers, large enough to add up to millions. And here's why that mindset matters, because it tells you something about the people who do this. They're not disorganized, they're not impulsive, they're patient, they're calculating, they understand the system well enough to exploit its weaknesses. That's not someone who made a mistake. That's someone who made a choice repeatedly for years. Now, I need to tell you what's happening in parallel, because this Minnesota case isn't isolated. While this owner was allegedly stealing from Medicaid, the same thing was happening across the country. In Florida, in Texas, in California, in New York, everywhere. The Department of Justice runs a healthcare fraud strike force. They've recovered billions of dollars over the years. Billions, and yet the fraud continues. It never stops. Every year, new schemes, new arrests, new billions stolen. Here's what that tells you. The enforcement isn't deterring the behavior. The penalties, when they come, aren't severe enough. The probability of getting caught is apparently low enough that people are willing to take the risk. And I want you to notice the pattern here. Every time there's a crackdown announced, every time the government holds a press conference trumpeting its latest fraud bust, the numbers keep getting worse. Not better, worse. In 2023, the federal government estimated that improper Medicaid payments, not all fraud, but a category that includes fraud, exceeded $80 billion in a single year. That's more than the entire GDP of many countries disappearing into improper payments and the personal care assistance sector. It's one of the most fraud-prone areas of Medicaid. Why? Because verification is hard. How do you prove someone helped a patient get dressed at a.m. on a Tuesday 3 months ago? You can't. You rely on documentation, on timesheets, on the honesty of the people submitting claims. When that honesty isn't there, the system bleeds. This isn't a bug in the system. At this point, it's a feature. We've created a healthcare payment infrastructure that's fundamentally exploitable, and we've never invested enough in the oversight needed to protect it. Here's what most people are missing in all of this. While the headlines focus on the big number 3 million stolen, there is a quieter cost that doesn't make the press release. Personal care assistance services exist for a reason. They're supposed to help people age in place, help people with disabilities live independently, help families care for loved ones without going bankrupt. When fraudsters steal from these programs, they're not just taking money, they're undermining trust in the entire system. Here's why that matters. Every fraud case becomes an argument against the program. Every stolen dollar becomes evidence that government healthcare doesn't work. Every bust becomes a talking point for people who want to cut Medicaid, restrict eligibility, add burdensome requirements that make it harder for legitimate recipients to get help. The fraudsters aren't just stealing money, they're providing ammunition to people who want to dismantle the safety net entirely, and the people who pay for that aren't the criminals. They're the grandmother who actually needs help getting out of bed in the morning. They're the disabled veteran who depends on personal care assistance to live independently. They're the children in poverty who need health care they can't otherwise afford. Those people lose twice. Once when the fraud happens, again when the political backlash makes their benefits harder to access. And here's the structural problem that nobody wants to talk about. The honest healthcare providers, and there are millions of them, are competing against people willing to cheat. When cheaters prosper for years before facing consequences, the honest operators pay the price. They're following rules that their competitors ignore. They're maintaining documentation that others are fabricating. They're operating at a disadvantage in a system that rewards fraud with years of undetected profit. That's unsustainable. Eventually, it breaks down. Either the honest operators give up, or they start cutting corners too. Or the programs they depend on collapse under the weight of the theft. Let me bring this down from abstractions for a moment, because all of this, the fraud, the enforcement failures, the political consequences, has real effects on real people. When $3 million gets stolen from Minnesota Medicaid, that's $3 million that didn't go to actual care. That's hours of assistance that someone needed and didn't receive. That's potentially life or death services for vulnerable people that were billed but never provided. We don't know the full extent of the harm in this particular case. We don't know if patients suffered because of care they didn't receive. We don't know if the fabricated hours meant real people went without real help, but we know the money's gone. We know the claims were allegedly false, and we know that somewhere in Minnesota, people who depended on Medicaid for personal care assistance were part of a system that someone was actively exploiting. That's not abstract. That's someone's mother, someone's father, someone's child with disabilities who can't advocate for themselves. Every fraudulent claim is a betrayal of that trust, and here's what keeps me up at night about these cases. The victims often don't even know they're victims. If you're elderly and confused, you might not realize the care aide who was supposed to visit never came. If you're disabled and dependent, you might not have the ability to report that hours were billed for services you never received. The people most likely to be defrauded are the people least likely to catch it. That's not an accident. That's why this sector attracts fraud. That's why this case matters. So where does this go from here? I'm not going to make predictions. I've been watching healthcare fraud cases too long to pretend any single prosecution changes the underlying dynamics. But I can tell you what to watch. First, watch the sentencing. If this case results in serious prison time, that sends a message. If it ends with probation, fines, and a slap on the wrist, that sends a different message. The severity of the consequence determines whether future fraudsters see this as a cautionary tale or a calculated risk worth taking. Second, watch for recovery. The government says over $3 million was stolen. How much gets clawed back? Fraudsters often spend the money as fast as they steal it. Luxury cars, real estate, lifestyle inflation that disappears the evidence. If recovery is minimal, the deterrent effect collapses. Third, watch for systemic changes. Does Minnesota implement new verification procedures? Does CMS, the federal agency that oversees Medicaid, use this case to push for better fraud detection? Or does everyone move on to the next headline while the underlying vulnerabilities remain untouched? Fourth, watch for connected cases. Fraud operations rarely exist in isolation. Are there other companies doing the same thing? Are there employees who participated knowingly? Are there others who saw the red flags and stayed silent? The network matters more than the individual. Fifth, and this is the most important one, watch for pattern recognition. This scheme allegedly went on for years. What could have caught it earlier? What red flags were missed? What data analytics could have flagged the anomalies? The answer to that question determines whether the next scheme gets stopped in months instead of years. I want to step back and ask a bigger question. Because this story isn't really about one healthcare owner in Minnesota. Not ultimately, it's about something bigger. It's about whether we've built a healthcare payment system that can be trusted. It's about whether oversight mechanisms are actually capable of protecting public resources. It's about whether the incentives in our system reward honest operation or punish it. Every time a fraudster succeeds for years before getting caught, it tells you something about the incentives. Getting caught eventually isn't deterrence. Getting caught quickly, consistently, reliably, that's deterrence. And we're nowhere close to that. Public programs don't defend themselves. They depend on people, investigators, who follow the paper trails, prosecutors who bring cases, judges who impose meaningful sentences, administrators who fix the holes that got exploited, whistleblowers who risk their careers to report what they see. When any of those links break, the whole chain fails. Right now, too many links are broken. Let me leave you with three things. First, this fraud was allegedly basic, not sophisticated. Not clever, basic false claims submitted over years. The fact that it worked tells you everything about the weaknesses in oversight. A system that can be robbed for years with simple paperwork fraud isn't a system that is working. It's a system waiting to be exploited. Second, the real victims aren't abstract. They're the vulnerable people Medicaid exists to serve. Every dollar stolen is a dollar that didn't provide care. Every fabricated hour is an hour someone might have actually needed. The fraud doesn't just cost money. It costs trust, access, and potentially lives. Third, deterrence requires consequences. Fast, certain, severe consequences. What happens in this case matters beyond Minnesota. Other potential fraudsters are watching, employees thinking about becoming whistleblowers are watching. The entire ecosystem of healthcare fraud is calibrated to the expected probability of getting caught and the expected cost when you do. These three things, the basic nature of the fraud, the real human victims, and the importance of consequences are all connected. They're different angles on the same question. Can we protect the systems designed to help vulnerable people? Or are those systems permanently exploitable? We're about to find out. Here's what I'll leave you with. Right now, a case is working through the system in Minnesota. One owner, one company, one alleged scheme, $3 million. It's not the biggest fraud case you'll hear about this year. It won't dominate cable news for weeks. Most people will scroll past the headline without a second thought. But it matters because what happens in cases like this, in courtrooms like this, determines whether the next person thinking about stealing from Medicaid sees it as too risky or entirely worth it. I'll be watching, and so should you.